The following PowerPoint is a public service announcement created by Group 4 regarding racism in healthcare. In order to discuss racism in healthcare, we must first define it. Racism and discrimination are deeply ingrained in the social, political, and economic structures of our society. For minorities, these differences result in unequal access to healthcare among many other things. On average, Black Americans have worse access to adequate health care and insurance than the rest of the nation. Not only that, but Black Americans are often microaggressed, underdiagnosed, untreated, dismissed, and perceived to have a higher pain tolerance. Differences in access to health care is one of the main reasons for existing disparities in healthcare provision. Another reason for these disparities is racial biases, where we see things like non-white Americans facing a difficulty being prioritized in the triage process. Lastly, we see very high maternal mortality rates in Black women, which is largely attributed to racial disparities. Due to lack of access, we see that Black Americans are less likely to be insured than white Americans. In fact, studies show that 1 in 4 Black adults reported not having a usual source of care. We also see that Black neighborhoods don't really have hospitals and other providers. Lastly, there's an insufficiency of financial resources stemming from the lack of generational economic mobility. Because of this, 1 in 5 Black adults were unable to see a provider in the past year on account of unaffordable costs. The National Academy of Medicine found that racial and ethnic minorities receive lower quality health care than white people, even when insurance status, income, age, and severity of conditions are comparable. The reason for this is implicit bias. Implicit bias refers to the attitudes or stereotypes that affect our understanding, actions, and decisions in an unconscious manner. This is dangerous because it is detrimental to Black patients who suffer at the cost of healthcare workers' biased opinions. Black women are statistically more likely to experience morbid illnesses and pregnancy complications, including higher rates of hypertension, asthma, placental disorders, gestational diabetes, and preeclampsia. These factors are exacerbated by the lived experience of racism. Chronic stress and intergenerational trauma negatively impact the health and well-being of Black women. Higher education, economic stability, and access to prenatal care improves the birth outcome for white women, but doesn't necessarily protect Black women from maternal mortality. In fact, the pregnancy-related mortality rate index for Black women is 5.2 times greater than those of their white counterparts. In order to combat these disparities, healthcare workers must explicitly acknowledge that race and racism play a huge factor in healthcare. With that being said, we must also acknowledge the fact that racism in healthcare is not only an issue limited to personal biases, but it is a systemic issue, and it's imperative that we are made aware of the damage it has done and is still doing to the Black community. Hopefully with this information, you are all better informed and will actively advocate against these injustices.